12 warning signs of mental illness you shouldn't miss. If you ask someone about mental illness, they would almost certainly mention dementia, Alzheimer's, or schizophrenia. Although these are some of the most severe mental health problems, many more go unnoticed. Depression and anxiety, for example, also have no visible symptoms. According to the World Health Organization, WHO, mental health conditions are among the leading causes of suicide worldwide. Identifying early warning signs and seeing a doctor as soon as possible will save lives. On World Mental Health Day, we look at 12 warning signs of mental illness that you cannot ignore. 1. Stomach pain. Consistent stomach pain is normally caused by acidity or indigestion. However, if you just get stomach aches when you're nervous or concerned, it may be a sign of a mental health problem. Have you ever noticed how people sometimes describe their anxiety as a knot in their stomach, as if they were on a roller coaster? According to Harvard University researchers, your stomach has a close relationship with your brain. When you are nervous or depressed, your brain sends signals to your gut to slow down. The brain suspends digestion so that it can concentrate on removing the threat. When this occurs often, it causes stomach cramps, bloating, and discomfort. 2. Chronic pain. Your stomach may be the first to detect changes in your mental health. However, if you disregard the warning signs, the rest of your body can suffer as well. According to estimates, people who suffer from depression are 3 times more likely to experience chronic pain. There seems to be an association in the brain cells that aid in the perception of pain and depression. As a result, any disruption in this network can cause you to become depressed as well as increase your pain perception. As a result, most antidepressants often serve as analgesics, painkillers. 3. Repetitive behaviors or tics. Do you have a friend who constantly taps their foot, speaks quickly, or bites their nails? Repetitive behavior is yet another indicator of ongoing anxiety and stress. People who suffer from anxiety appear to be restless much of the time, and as a result, they exhibit subconsciously repetitive behaviors. This is referred to as psychomotor agitation in psychiatric terms. This agitation often leads to sleep disruptions and exhaustion. 4. Uncharacteristically passive or aloof behavior. Everyone has a unique personality. Some are quiet and withdrawn, while others like going out and socializing. However, if your usually friendly friend withdraws from friends and family and tends to live alone, this may be an indication of depression or bipolar disorder. Although it is normal to need some me time from time to time, people suffering from some mental health problems, especially depression, tend to be more withdrawn. They have flat or blunt facial features and a flat or blunt tone of voice. However, there is a disorder known as smiling depression that is at the opposite end of the social withdrawal continuum. People suffering from this form of depression may appear happy on the outside despite harboring passive suicidal thoughts. This form of depression is much more difficult to identify because it lacks the usual symptoms. You may be suffering from this type of depression if you wake up feeling exhausted or unable to find the motivation to complete daily tasks. Speak with a friend or a doctor about getting an intervention. 5. Weak immunity. According to a 2004 study conducted at the University of British Columbia in Canada, people who experience anxiety and stress are more likely to become ill. This is because if a person is concerned about something, their brain sends signals to their immune system, which gradually suppresses overall immunity. People who are stressed are more vulnerable to even the most common infections. Surprisingly, stress may also cause the immune system to go into overdrive and become hyperactive, potentially leading to autoimmune disorders like rheumatoid arthritis and lupus. 6. Drastic mood changes. It is normal to feel angry, sad, or emotional depending on our circumstances, but excessive dramatic emotional outbursts such as rage or crying on a regular basis can indicate depression or another mental illness. 7. Constant sadness. If you or a loved one is always sad, teary, or hollow on the inside, you or they might be suffering from depression. Even if your life is fine and all is going well, you will always feel sad if you are depressed. This is due to the fact that depression is a psychiatric disorder over which you have little control. 8. Unexplained guilt. Being overly critical of oneself. having low self-esteem or feelings of worthlessness, and blaming oneself for all that goes wrong are all symptoms of a mental disorder such as depression. If you find any of your family members or friends struggling with excessive remorse and discussing suicidal thoughts, do not dismiss them. They may need urgent medical attention. 9. Worried about everything. It is normal to be concerned in certain situations, but if anxiety becomes a part of our daily lives and interferes with our ability to function, it can be a sign of an underlying mental health disorder. Anxiety signs include heart palpitations, headaches, shortness of breath, diarrhea, and restlessness. 10. Sleep changes. Constantly disrupted or erratic sleep patterns can indicate mental illness. Insomnia, sleeping too much, too little, or not at all, may be a symptom of a sleeping illness, depression, anxiety, or drug abuse. 11. Substance abuse. Alcoholism and opioid addiction have been linked to mental illness. People who use alcohol or drugs to cope with emotional or mental stress may become dependent on them over time. Substance abuse can also lead to mental health issues such as depression in some situations. 12. Changes in appetite and weight. Changes in appetite and weight are typical diagnostic signs of severe depression. Although some people lose interest in cooking and/or eating, others may binge eat in order to relieve their emotional hunger. Managing mental illness. The first and most significant step in the healing process is acceptance. Recognize that you or a loved one might need assistance and possibly medical treatment for a mental health disorder. Don't be afraid or embarrassed to bring it up. Depression and anxiety, for example, may be controlled or treated with medications and therapy. Feel no shame or assign blame. Open up, speak to your family and friends, and seek medical attention. Learn about mental health, associated conditions, their symptoms, and the therapies that are available. Don't expect instant gratification. Recovery from a mental disorder will take weeks for some people and years for others. Each case moves at its own speed and has its own setbacks. Consider family support. That's all for now, guys. Please like and subscribe, and let us know in the comments what you'd like to see next.